Yeah. Hello everyone, I am Julie.
Hello everyone, I'm Paul.
Hello everyone, I'm Francesca.
Hello everyone, my name's Ben Law.
Hi, I'm Hannah. I'm the Learning Disabilities and Vulnerabilities Lead at SWASFT Ambulance Service.
We're the
Healthy Cornwall CHAMPS team. Yeah, Healthy Cornwall CHAMPS team. CHAMPS stands for Cornwall Health and Making Partnerships.
We're here today to talk about the SWASFT Ambulance Service new Learning Disability and Autism Plan.
Why this plan is important.
And we're going to talk about what a learning disability is. I've a learning disability, and to everybody is different. And for me, it's hard to sometimes describe what it is because people think it's just learning, but it actually covers a lot more than just learning. Some days it could be that you forget things, or you get muddled with some words, or that reading is hard to understand. I struggle with long numbers and long words to read. And sometimes it's hard to actually, sometimes you think a word up here, but then it's hard to actually say what you're thinking, which is really hard for me.
Okay, so I'm talking about what autism is. So autism is a spectrum of different conditions that are all controlled by how people's brains work, how people's brains are wired. They're wired differently to neurotypical people that don't have autism. And autism is a really complex spectrum because it includes different spectrum conditions, and a wide range of people on it with different strengths and weaknesses, because autism is so complex because autistic people can, on the one hand, they can be able to do things that are just like genius that a lot of people can't do, but on the other hand, they can struggle with everyday tasks that that neurotypical people can take for granted, like being able to read body language is something that a lot of neurotypical people just do as second nature, being able to take for granted, but it's difficult for autistic people to be able to understand body language. And social skills, so understanding social cues and just being able to understand social cues and being able to cope with social situations and just with everyday tasks really can be a struggle.
People with learning disabilities and autistic people die about 20 years younger than people without a learning disability or autism, often because of poor care.
Nearly half of these deaths could have been avoided with good quality care.
Autistic people who do not have a learning disability are 9 times more likely to die by suicide than those without autism. People with learning disabilities from ethnic minority groups are even more likely to experience worse health care. The average age of death of someone with a learning disability and ethnic minority background is 34.
The plan will help people with learning disabilities and autistic people to feel confident and safe when they are in need of using the ambulance service.
So can you tell us why it might be difficult for somebody with a learning disability or an autistic person to use healthcare?
I think the reason is because of the hospitals are very noisy environment, especially with guys dealing with them, the beepers going off every 5 minutes, the things they put in your arm, that thing is so where it goes and also the carers, the nurses only speak to my mum especially, but to me, my mum says to me really, I don't think that should be right. I think they should be talking to the person that actually is. Person with learning disabilities, myself in the bed. I think it should be And also what Julie was saying about hospital passport is the most important thing for someone like me who needs to go in hospital, because that's the most important thing, because they can put it on their screen. If it's red, it knows it's somebody important like me coming into hospital.
How might using the ambulance service make you feel at the minute?
I think it makes it really worrying for someone like me, who anybody who's got learning disabilities. It might be so weird, it might be, the noise might be really bad, especially that the oxygen they give you, it's like, it's like the breathing stuff, I know. And also watching on the telly is a quite scary thing. When you watch it, like, there was one on the programme, it was very scary indeed.
Hospitals, environments, and using an ambulance can be daunting and anxious for autistic people and people with learning disabilities, because if they don't know what to expect, then it can make them really anxious, because they don't know what's going to happen to them when they go there. They don't know how they're going to be treated. They don't know who's going to be there to see them and speak to them and interact with them, and they don't know whether they will be able to interact with them and communicate with them and be able to help them and talk to them and try and communicate with them, try and find out what the problem is, and not just talk to parents or carers, but actually try and communicate with them and find out, you know, if they can, find out what's wrong and try and really, because if ever I go into hospital or go and see my doctor, if I've got a pain, I find it difficult to describe it. They ask me, is it a dull pain or a sharp pain? And I find it difficult to describe. So I think people like me need help to be able to try and ascertain what the problem is, and like kind of, you know, just something as simple as feeling of pain, being able to, you know, have the right people to be able to help us, like determine, like establish what kind of pain we feel and how best to treat it, and that kind of thing.
The thing, a really big thing for people with learning disabilities and autistic people is it's very hard for us to understand sometimes what the healthcare people are actually saying to us. They use really long words and not easy to understand. So if we're having a thing like a heart attack, just let us know you're having a heart attack rather than big words. It makes us more confusing and it makes us more worried what's happening to us. And if you're going to feel having just a test to touch us, just let us know what we're going to do to us before it's going to happen. It just takes away a bit of the stress and the worry.
In this plan, we have 4 main aims. They are
understanding how we work with people with learning disabilities and autistic people.
Working together and engagement.
Developing a skilled workforce.
accessible services.
I'm going to be talking about a little bit about what my title means. Mine is understanding how we work with people with learning disability and autistic people, and it means learning from past experiences and making positive changes.
Working together and engagement, that means meeting people with learning disabilities and autistic people and learning from them.
My title is Developing a Skilled Workforce, and we provide training opportunities for learning disability and autistic people for all staff.
In this plan, we talk about accessible services, and this may mean making reasonable adjustments. Ben, can you tell us an example of a reasonable adjustment?
I think it's my carer needs to be in the ambulance as well, because it's most important, because if she wasn't there, I don't know what to do.
Yeah. Francesca?
My reasonable adjustment is I wanted my family to be with me in hospital when I'm poorly, because when I had pneumonia, I had stayed in for a week, and that was the most scary, most traumatic time for me. And so I wanted my family to be with me all the time.
Yeah, cool.
My reasonable adjustment is communicating with people, trying to find a way to communicate with the person and trying to find out if they have any reasonable adjustments they might need, which could be like dimming lights, it could be reducing noise or some other kind of sensory thing that is bothering them, just communicate with them and try and find out, you know, if you can, if there's anything that reasonable adjustments they need made to help them feel less anxious and feel more safe. And yeah.
Perfect. Julie?
I'd say that to maybe find out the best way to talk to them, that if they need pictures or Makaton or easy to understand words, and to try and use nice pictures. If they have a picture book they can take their mind off all the awful things that's going on to that person, and to try and find a nice quiet area, because the hospitals are very busy and they're very stressful for people like us, that there's a lot going on and you're already worrying about yourself and what's happening to you and everyone else. So I think hopefully if it's possible to find a safe room would be nice.
So that's a little bit about our new Southwest Ambulance Service Learning Disability and Autism Plan. Thank you all for helping me.
Thank
Thank
you
you
for listening from all of us, CHAMPS.
CHAMPS.